We sit within the Center for Children's Healthy Lifestyles and Nutrition, and we're really excited to be hosting these quarterly meetings and for you all to join us. So I'm going to start with this first row right over here because these are two other members of our team.
Hi, Robin Shook, Director of the Kansas City HLC.
That's Dr. Robin Shook.
Natalie Updike, I'm on the Kansas City HLC team as well.
And Natalie Updike, who are both part of the KC HLC team. Joan, I'm going to go to.
Sure. I'm Joan Delahunt. I'm an occupational therapist and an associate professor at Rockhurst University. And I also work with Operation Breakthrough. So
Great. That's Delahunt from an OT from Rockhurst University. Ruth.
Ruth Bloom from Win for KC Director. And we just finished up 3 weeks of Camp Win. Woo! Very excited, but yeah, just happy to be here.
That was Ruth Feldblum from Win for KC. Lee.
And I'm Lee Kurtzneck and Program Director at Girls on the Run.
And Lee Kurdick from Girls on the Run. Jen, we'll just start with you since you're right behind Lee.
I'm Jen Jett. I'm the superintendent of community services at KC Parks.
It's Jen Jett from KC Parks.
Megan McClure, YMCA Head Start.
Megan McClure from YMCA Head Start.
Hello, Ed Kramer. I'm a family doctor. I'm with KC School of Medicine, and also if we ever have our first meeting, the brand new Lead Summit Wellness Coach.
Oh, wow. Congratulations. That's Ed Kramer from, a physician from UMKC.
I'm Shannon Marguerito. I'm from Children's Mercy. I'm a PT and the research coordinator for the sportsman department. And I'm here. Jay Robertson asked if I could sit in. So
Thanks for coming. And that's Shannon from Sports Medicine. She's a physical therapist at Children's Mercy. Okay, we'll go ahead and start in the front row.
I'm DC Oconta. I'm a disease investigator from Johnson County Department of Health and Environment.
DC Oconta from Johnson County Department of Health and Environment. Great. Okay.
Kira Idris, I'm program manager for Center for Family and Community Connections over at Children's Mercy.
And that's Kira Idris, one of our speakers this morning. So you'll hear me give a little bit more introduction about her in just a minute.
Everyone, I'm Jamie. I'm from an organization called Canby's Markets.
And Jamie Platt.
Yes, sorry.
From Canby's Market. Okay, go ahead.
Hello, my name is Deanna Williams. I'm the nutrition service manager with Harvest.
And Deanna Williams from Harvesters.
Yes.
Rhonda.
good morning, Rhonda Erpelding with Harvesters, and I'm in the program manager for the Fun Snack and School Camp. I'm also the sector lead for the KCA Early Childhood sector, and I'm also the co-lead for the for the early childhood sector too.
That's Rhonda Erpelding from Harvesters.
Donna Martin with Mid-America Regional Council, project director for both Double Up Food Bucks and a new program called KC Fresh RX.
And that's Donna Martin from Mid-America Regional Council, also one of our presenters this morning.
Familiar with MU Extension as a community health specialist.
Okay, and say your name again.
Beluke.
Okay.
With MU Extension.
Beluke with MU Extension. Okay.
good morning, Janet Brown, University.
And that's Janet Brown from University Health. Katie? And that's Katie Amy, another one of the KC HLC team members.
I'm Denise Dias. I'm the director at K-State Research and Extension, Wyandotte County.
Okay, Denise Dias from K-State Research and Extension in Wyandotte County.
And I'm Alex Francisco. I'm the Chief Science Officer at the Kansas City Health.
And Alex Francisco from the KC Mo Health Department. Okay, great. Evelyn, we're going to turn it over to you and let you unmute those who are participating online.
All right, well, I guess I can go first and then whoever, I can call on people or you can just unmute yourself. But my name is Evelyn Donis and I am a research associate at Children's Mercy. And I have been assisting Shelley with some other projects at the center as well. And I guess I can call the next person, Bill, if you would like to introduce yourself.
Good morning, everyone. My name is Bill Brandmeier, and I'm with the Shareways Foundation, and I am the sports sector lead along with Adrian Robertson from Unite KC. Excited to be here. Wish I was in person. maybe I might make it down a little later today so I can see everyone. Thank you.
Thanks, Bill. The next person I see on the screen is Sandra Reese.
Hi, everyone. My name is Sandy Reese. I'm a dietitian at the Johnson County WIC office. I also attend the early childhood sector meetings and the public health sector meetings.
Thank you, Sandy. Joey?
Good morning, everyone. Joey Leitner. I'm an assistant professor over at UMKC School of Nursing and Health Studies.
Thanks. Jill Rayford?
Hi, I'm Jill Rayford. I'm with Johnson County Department of Health and Environment, and I'm also on the school sector.
Thank you. Andrea Clark.
Hi, my name is Andrea Clark. I'm a food system planner at KC Healthy Kids. Excuse me, and work with the Greater Kansas City Food Policy Coalition.
Thank you. Heath Harris.
Morning, I'm Heath Harris. I'm with the Lee Summit Parks and Recreation. I am a facility manager over here at the Longview Community Center, and I am a part of the Parks and Rec sector.
Thank you. Sarah Gorman.
Good morning. I am Sarah Gorman. I work with the Missouri Department of Health and Senior Services, and I am our Maternal Child Health Services Program Manager.
Tara Caldwell.
Good morning. I'm Tara Caldwell. I am a registered nurse and program specialist for Missouri's Child Care Health Consultation Program over in the DESE Office of Childhood, and I'm also part of the Early Childhood Work Group.
Thank you. Tonya Williams.
Good morning. I'm Tanya Williams, team lead of Wellbeing and Fitness at Garmin.
Thank you, Tanya. Laura Green.
Hi, my name is Laura, and I am the health educator at Webster County Health Unit.
Thank you. Ashley Young.
Hi, I'm Ashley Young, and I work with Tara Caldwell, Ashley, who already introduced herself, and we work with the Child Care Health Consultation Program.
All right, thank you for joining us. And Sarah Hetman.
Hello, I'm with the Missouri Department of Health and Senior Services with the Maternal Child Health Services Program, and I'm the Northern District Nurse Consultant.
All right, thanks everyone. I believe that's everyone who is virtually.
Thanks, Evelyn. So great representation both across the metro and then even it seems from the state. So thank you all again for choosing to spend your time with us this morning. I'm going to skip that and we're just going to go straight into our presentations this morning. I really want to give people an adequate opportunity to both share what they're doing, but also give you all a chance to ask questions. And then again, for other organizations that are offering programs or opportunities to increase access to healthy food, I'd like for them to be able to weigh in this morning as well. So without further ado, thank you so much to our presenters this morning. I'm going to share a brief bio on each of them. We're going to have Akira from the Center for Family and Community Connections go first, and then we'll have Donna Martin second, and we'll have Jamie right after that. And so Akira has been an employee at Children's Mercy for 4 years and currently serves as a manager at the Center for Family and Community Connections. That's at the Broadway location of the Children's Mercy health system. With Akira's long-standing background in the field of social work, she shared that she has a continued passion for supporting individuals and families through advocacy and strives to empower patients to make informed decisions regarding their health care. So she's going to talk a little bit about what opportunities there are available at Children's Mercy. I'm going to go ahead and introduce everyone first, and then I'll have you come up. Donna is a project director for the Double Up Food Bucks Heartland program, currently funded by a USDA Gus Schumacher Nutrition Incentive Program grant. She oversees all the activities of the Double Up Heartland Collaborative, which is made up of partners implementing the Double Up Food Bucks incentive in Kansas and Missouri. How many of you are familiar with the Double Up Food Bucks program? Okay, the majority, that's great. She is also the project director of a new produce prescription program in the metro area called KC Fresh RX. We're really excited to hear more about that. She holds a bachelor's degree in political science and environmental studies from Baylor University and master's degrees in both planning and public health administration from the University of Minnesota. And then we have Jamie Plack, who is the impact strategist and community engagement coordinator at Canvas. How many of you have heard of Canvas? Okay, great. Also, excellent. I have a sorry, I should have changed the wording on that. He has a master's degree in community health from the University of Kansas. And through his work at KU, developing innovative ways to create more healthy food access and healthier communities overall has become a major professional passion. So again, really excited to have all of them here with us today. I am going to, let's see, try to bring up your presentations. Don't you love it when everybody can see everything you're doing on the screen? Is it going to work? Is it not? There we go. Okay. And without further ado, I'm going to welcome Akira.
Thank you, Shelley. So yes, I am Akira Idris. I am program manager, one of the program managers for the Center for Family and Community Connections, long title, sorry guys. So the goal of our location over at the Broadway Center is to be a centralized location for resources, a connection hub for our Children's Mercies, patients, and families. So we assist patients and their families with their basic needs. We also provide community resources. So just increasing access to Children's Mercy resources within the community as well as within the hospital. And our goal, of course, is to grow community engagement. So to do that, we try to address the social determinants of health before each screening over at our Broadway location, which we consider our pediatric care clinic. So that is where all of our families have their wellness appointments, allergy appointments, things like that. So we address those by doing a screening before those appointments in order to improve health and reducing long-standing disparities in health and healthcare. Families come to the CCC after an appointment to provide or to obtain those tangible assistance, including wraparound services through community-based organizations throughout the neighborhood. We work with the Hunger Free Hospital Council. That's with our Dr. Plensner and Dr. Krager. Through that, we have our community garden, Kids Eat Free program, Fruit and Veggie Connect program, the food pantry, and then as well as that SDOH screening prior to those appointments. Upstairs on the 7th floor at our Broadway is where we are housed. That is the CFCC. Also at our Adele Hall location, which is the hospital downtown. Wait a minute. That is where we have our Center for Family and Connections. So prior to our new initiative, we just had the Center for Community Connections. Now we also have expanded some of those programs into our Adele Hall location for the Center for Family Connections. So of course, there at the hospital, we work with our patients that are inpatient, as well as those coming to and from those complex appointments. And so we support that through the social work department to provide meal vouchers, lodging requests, transportation requests. And of course, at our Broadway location, we work with Canby's Markets and also Harvesters for our food pantries and our cooler closet that we have. We also have Happy Bottom. We're a distribution center for that, giving the basics. And we do also assist patients with those legal needs with our KLS partnership. So back to the social determinants of health screening. Like I said, each patient that has an appointment that comes to Children's Mercy, they fill out a screening. And that is how we know when they come to the appointment that we would want to address some of those basic needs. This is the screening tool that we have. So families answer those questions in regards to food, housing, transportation, utilities, and we also provide gun locks up on the 7th floor if that need shall arise. So those are just the questions that we ask in regards to their living situations. If they have any concerns with access to food, this is on a timer, anyone who comes up here, and utilities, and then as well as transportation. So we want to see if we can address those ahead of time. If families do not fill that out prior to the appointment, we also have our nurse and our doctors just review those and be able to assess that when they're actually in the appointment. So what we do is we receive that screening that is done prior to those appointments so that we are ready to assist the families. So again, even if they don't fill out that longer screening ahead of time, we ask those questions again once they get into the appointment, because we know sometimes ahead of time, it's just hard to be able to identify that need. So in regards to if those families do not have the need for those tangible items that we have available upstairs, like our food, our gun locks, things like that, then we are able to provide them resources through our partnership with Lift Up KC. We work with this, one of their program managers, in order to obtain all of those resources within the community, which is mainly a system where families are able to navigate through it. It's kind of like Aunt Bertha's. I'm sure everyone's familiar with that, but we're really working with those community agencies to put their information on Lift Up KC. We're really wanting to have people link up to that, so that way we don't have to provide papers all of the time. Families are able to access that on their own. We are able to refer them, or families can self-refer themselves for those additional needs that may be long-term. So of course, our goal is really to just be a one-stop shop at Children's Mercy, so we can provide those resources when they're there at those appointments. Okay, so our food pantry, it opened up a couple years ago through our partnership with Harvesters. It is grant funded, so they do come weekly to stock those items, which we have, that's just a small picture of what we have there, but families are able to shop with 10, or they are able to obtain 10 items, mix and match. Families are able to shop for really what interests them. Some families might want rice and beans, others might find better need with those infant food items. So there's a multitude of items that families can choose from there. And then through our partnership with Canby's Market, which is also grant funded, and that is part of the Hunger-Free Hospital Council. We were able to obtain a partnership with Canby's Market. They provided the first cooler that we have, and then we were able to purchase another one, which we have for stock, for overstock. They come once a week, typically on Fridays, to provide those items. So our staff over at the CFCC, they kind of look for what families are taking, so that way we know what to order each week. Mangoes go really quickly, so that's something that we order a plethora of, as well as, you know, those lettuce items or some of those summer items that we talked about this morning. So we have decided to do that on a point system, so that families are not only able to take 5 items, but more so they're able to take a larger. So what that looks like is like 3 mangoes would equal 1 point. A stock of broccoli would equal another point. 5 bananas, that would be a point. So you are able to take 5 points of any of the fruits and vegetables that you like. So they're able to take more home. In order to do that, and in order to continue to work with that grant funded opportunity we have, We do temperature checks every morning. We also make sure that there's nothing spoiled or molded. We clean our floors every day, as well as we have a scale that is sitting next to that. So after the families are able to shop, we just track what they are taking home. And one of my babies is actually our webinar series that we just started. So that did launch this month. You know, we're close to July. So the CFCC is working with Integrated Care Solutions to bring a free educational webinar series to our patients and families. And the goal of the webinar series is to provide different topics each month that would be helpful for families. So we want to provide them with an opportunity to learn. That way we can cut down on those unnecessary hospital visits. So attendees, they scan the QR code that takes them to our website. They're able to sign up for topics of interest. We're constantly marketing this, and families are able to learn about different topics like healthy eating, especially for our month of July is actually going to be healthy eating and lifestyles. So that is something that's coming up next month. Also financial resources. This month we talked about Medicaid, anxiety, depression, kids safety, everything like that. So it's a lot of good programs and topics that we're coming to bring. So like I said, they scan the QR code, takes them to the website. They will need access to the internet, of course, to view that, but it is on live feed. So families are actually able to answer or ask questions, and then our presenters will then answer them based on the chat that we have going on there. And then a subsidiary from our Canby's Market where families are able to shop. We also on Fridays now have our mobile pantry. So we take that down to the first floor so that families that are coming and going from their appointments are able to just retrieve items. Those are our leftover stock items that families may not have gotten through the week. So that way, that's right up front. When they enter in, they see security and they also see our lovely volunteer. I was telling you about the scale. So we continue to do that entire process so we can know what items families are able to, well, what they enjoy and what they're able to take home. So our Kids Eat Free, we have that at several of our Children's Mercy locations. We have that at our Dale Hall location east. Unfortunately, we will not be hosting that at Broadway just due to unforeseen circumstances. We're not able to offer that, but typically yearly, it is for ages 1 through 18, Monday through Friday. Lunch is offered for 2 hours throughout the day. So families, no questions asked, are able to come and they're able to obtain a sack lunch for all of their kiddos. You know, Shelly's going to talk more to you about the community garden. Of course, we partner with, again, the Hunger Free Hospital Council for that.
Thanks. Since this is about access to healthy food, we wanted to make sure you see how all of these programs are sort of connected and organized at Children's Mercy. So the community garden has been in place since 2018. It is a little bit north of the Children's Mercy Adele Hall campus on a vacant lot that the hospital owned and had no real plans for. We currently have 8 raised beds, a 30 by 40 in-ground bed. We have a shed to store our tools right there on site. We have drip irrigation. We have a paved path that goes all the way around the garden and up from the sidewalk so that people of all abilities can come up and spend time in the space if they choose to. We have a 17 fruit tree orchard. We have a shelter and we have a beehive. We are a partnership garden, so we're considered a community garden of Kansas City Community Gardens. We have a partnership with Missouri Extension Master Gardener Program, so they're master gardeners, come out, provide volunteer support, but also help us to provide information and education for families. Missouri Hives is who supports the beehive that's in the area. And of course, what we didn't talk very much about is our Fruit and Veggie Connect program. And that's where we take produce from the garden. We take it over to Canby's, which is an organization that's well set up for packaging and distribution of produce. And we're not. We take it over to their location. They package it up for us. We have a courier take it to a home visiting program in Wyandotte County, where it's then distributed in-home as the home visitor visits families. We've done this for 2 years. It's the home visiting program that we've currently partnered with as Parents as Teachers in Wyandotte County. We started off with 25 families. We were able to expand to 50. It's a very well received program. People are very interested in doing it. But as you can imagine, with a small community garden like this, we can't necessarily supply enough produce to really scale it at a level that would potentially have a bigger impact. But what we're trying to do is connect organizations and programs that are already in existence without recreating the wheel. So we really thank our partners because we can't do this without them. So our garden is maintained 100% by volunteers. We have, since 2018, we've had just under 300 volunteers who spent over 2,700 hours in the garden. We've harvested over 2,200 pounds of produce, and that does not include anything that we've done this year. You want to join us? You can email us at communitygarden@cmh.edu. Okay, so with that, what I'd like to do is give you all a chance to ask any questions about the CFCC at Children's Mercy or any of the programs that we have that provide access to healthy food. And while I'm going to turn this over here so you can answer these questions, and I'm going to try to bring up the next presentation.
Okay, sounds good.
Hi, we have a question in the chat actually.
Yeah, go ahead.
Okay.
Sandy, do you want to ask your question?
Sure. So I was just wondering, I know this is all food related, but regarding the classes that are available, I know you talked about some of them, but do any of them have any, are there any parenting classes that people can attend as well?
Yeah, so that's a good question. Children's Mercy, just in general, does not offer what we consider a traditional parenting class. However, we do, through our mental health initiative, actually have what's called our care workshops. So if you go to the website or have families go there, it's an opportunity for them to learn different techniques for difficult behaviors. That's for generally ages toddler through 17 years old, actually. So they offer a 2-hour workshop, and it is twice a month. So it is in 2 series. So you have one series that's 2 hours, and then the second. So families are able to sign up for that, and that is free as well. That's just for children who may have difficult behaviors. And then also just throughout the hospital, there are different clinics that offer specific programs for specific diagnosis. So all of those are available on the Children's Mercy website, as well as the new webinar series. So we will then host different topics each month. Families throughout the community are able to sign up for that for free, and they will just, register for topics that they're interested in. So those, again, are live. So they can join the session and then ask those questions through the chat anonymously if they need more guidance on particular topics.
Thank you.
You're welcome.
Are the food pantry type resources talked about only for patients, or is there any community opportunity for that too?
So we are not yet marketing to the community because just of what we have to offer. And kind of like Shelley said, we eventually will try to offer that over at the hospital location, but right now it is specifically for Children's Mercy patients. So the way that I say to market that, because we don't turn anyone away, right? If you know of a patient that is consistently seen at Children's Mercy, have them come up to the 7th floor. But we do not market that within the community just yet because of capacity.
Yeah. And I think the other thing, to that question is we want to make sure that we're directing to people to resources that are convenient to them. So the Children's Mercy Food Pantry would only be convenient if you were actually on campus coming for a patient visit. And so we want to make sure they're connected to harvesters, or they know where Canby's community coolers are, or other resources that are a little bit more convenient. But if they happen to be near the campus, as we begin to expand some of these programs, then we'd want that to be another opportunity. So that's a great point about why we're doing Kids Eat Free. So if your child was missing their summer meal because they're not at summer school or something else, but you have an issue with access to healthy food, we want to make sure that while you're on our campus that you have an opportunity to have lunch as well. So again, not trying to interfere with other programs that are going on, but trying to align better so that opportunities exist in convenient locations. That's a great question.
It is. And just going back to our partnership with Lift Up KC, one of their program managers is consistently updating that platform so that families can go on there and look for those alternative food pantries who are able to assist them more frequently. So we're also trying to address the long-term need, not just, while they're at appointments there.
Could you say just a little more about Lift Up KC in case people aren't familiar with it?
Yeah, absolutely. So Lift Up KC is a platform that offers resources. Let me see if I can go back. Oh, well, I don't want to. It has a mind of its own. So Lift Up KC is just a general resource platform hub. And I'm not sure if anyone is familiar with Aunt Bertha. I don't know if that's just a social work thing, but families are able to go on there, as well as our Children's Mercy patients and families have a link to that through their patient portal. So what that looks like is it provides resources for utilities, summer programs, food resources, all of the standard social determinants of health needs, and they're able to signify what particularly they need help with by their zip code, and it will provide to them any resource that has connected to Lift Up KC. So we're really wanting all of our community partners. It would be great if everyone, and I can provide that contact information, would provide their information onto Lift Up KC. It has a blurb about what that organization does, as well as what the requirements would be in regards to if they need a copy of your lease or how far behind are you on your rent. They ask questions like that, and then it can navigate you to that particular resource to provide that exact link so that someone can then get in contact with you. Those are good questions.
Yeah, great questions. Okay, and there'll be another opportunity at the very end as you hear the different programs our organizations share about their programs. It may bring up other questions. We'll have a chance to ask those at the end as well. So with that, I'm going to invite Donna Martin to talk about the Double Up Food Bucks and hopefully a little bit about KC Fresh RX. Thanks, Donna.
Yeah, thanks. Okay, well, I'm gonna primarily focus on Double Up Food Bucks, and then I'll talk just a little bit about the KC Fresh RX since it's really new and I don't have a lot to results yet to tell you about, but I will mention what we're doing. So Double Up Food Bucks. So I did see a lot of people were already familiar with it, which is good. So this might be a review, and that's fine. It's always good to have a refresher. So Double Up Food Bucks is a healthy food incentive program, and it's modeled. It uses the same model that is used by about 28 other, maybe even more now. That was a couple of years ago, but so there's about 28 to 30 different grantees that are doing this model. It was started by Fair Food Network in Michigan, and they have been very successful in Michigan doing it with their farmer. They primarily do it with farmers markets, and then I think there's one grocery store that they're doing it with. Everyone's a little bit different. So ours is one of the few 2-state programs. I think it might be the only actual 2-state program in the country. And we have 3 main objectives to our program. The first is to help families bring more healthy food home, more fresh fruits and vegetables home, so that, you know, obviously they can have fresh produce to eat. Also helping farmers, our local farmers, make more money and keeping more of those food dollars in communities so that our communities can remain strong. And this is particularly more and more, this is particularly a real issue in our rural areas. If you have not been out into rural Kansas or rural Missouri lately, the food landscape is dire in many of our communities. So it's becoming almost a passion of mine of how we can help support local grocery stores who are now it's not Walmart anymore. It's food, Family Dollar, food, you know, all the food, Dollar General, whatever, that are really, really seriously threatening places where people can actually buy fresh fruits and vegetables. So Double Up Food Bucks in the Heartland, we're currently funded by 2. This program is currently funded by 2 grants from the USDA. One is a regular, if you will, USDA GUSNIP grant. That's an $8.1 million grant over a 4-year time period. That grant basically covers from the state of Kansas and also Western Missouri. That grant requires a dollar for dollar match. So whatever we ask for the federal government, I have to find a match for with local funding. And I will put a plug in here that, you know, if you have contact with your local, any local elected official that's at the federal level that has any influence on the Farm Bill, if you could put a bug in their ear that they need to reduce that match, that's a serious threat to this program continuing, because we've been doing this program for 8 years. Funders get fatigued. They go in different directions. So we need to get that word out that a 50% match. So our program, as you see, is completely, the whole program is $12.1 million. So to do that to match that program, obviously we would need more than $6 million in match funding. So significant issue. COVID, so the rest of Missouri and some new locations in the KC area and in Kansas are being funded by a $4.35 million grant that was we received as a COVID relief and response grant. The beauty about that grant is that it required no match funding. In Missouri right now, outside of sort of the Kansas, the Western area, it's very, very difficult to find match funding for really any nutrition program. So, so that I feel like that's that area, and ironically, that those areas of Missouri are the areas of Kansas and Missouri that have our highest need. So, you know, it's like weird how life works. So, so those 2 grants anyway are what support us. I will add right now that, you know, you said we can't do these programs without our partners. You'll see at the very end the whole kind of list of the logo soup of our partners. We definitely could not do these programs. I could not, Mark could not do any of this without our partners. What Mark brings to this program is sort of fiscal administration, coordination, the advertising, all the communications and media is done by Mark, but really the boots on the ground are Kansas State University Extension, MU Extension, Cultivate KC, West Central Missouri Community Action Agency, KU Med Center. So And that's just the core, right? And then we have all of you as our partners as well. We definitely consider all of you all as partners because you have trusted relationships with SNAP recipients. So I don't want to be remiss in saying that it is a huge effort that, you know, to get to do this program. Double Up Heartland. So our scope, the grants that we have right now are from 2021 to 2024. That's at least the first one is. So in 2022, we had a total of about 151 locations offering the program across the 2 states. This year, I believe we're up to 165 that are projected to be on the program. And we are kind of just up, you know, kind of in that ramp up period, especially for farmers markets. So it's an exciting time right now. Lots of things are going on right now. This is kind of our scope. We're really trying now to look for grocery stores and farmers markets that are in communities where we don't have locations, and also that have, you know, high need in terms of food insecurity, poverty, just a whole different variety of measures. So, and every community, we're also trying to look at the communities, like you can see Liberal's on there. I'm not sure we have a dot on there, but Liberal we have added this year, and that's a very unique community. We believe probably at least 80% of the folks that would use this program would be Hispanic in that community. So, you know, every community is really different, and we're really trying to meet them where they are and find community partners to work through to kind of get the message out to them. So how does it work? Just a real quick review. At farmers markets, the way it works is that they would go up to a booth that has the EBT reader, and they would purchase tokens that say SNAP on them. And then once they do that, they get a matching amount up to $25 a day of Double Up Food Buck tokens. The SNAP tokens can be used just like their SNAP card, and the Double Up Food Buck tokens are only for fresh fruits and vegetables. So, and ideally they would go through the market and, you know, in a perfect world, every single produce vendor is going to have that sign out that tells them that, you know, come and spend your tokens with us. So, so that's kind of how it works at the farmers market. And by the way, the Double Up Food Buck tokens can be used at any participating location. So even if you got them at Independence Farmers Market, you could use them at Overland Park or City Market. The SNAP tokens are not that way. Once you buy those SNAP tokens, they have to be spent at that market. Farm stands and mobile markets, it's just a really simple 50% discount. So once you buy your fresh fruits and vegetables, they just discount that price by 50%, up to $25 a day. And then at the grocery store, you buy your fresh fruits and vegetables. And once you do that, the amount that you spend, you get a $25 either a credit or a discount depending on the capability of the store. In the Kansas City region, all of our stores use a loyalty card, so it's tracked on their loyalty card. That's one of the most common questions I get. A lot of people think it might be going back on their EBT card. We don't have that in Kansas or Missouri yet. Only time will tell if we ever do, but it will be a different model if we get that. So it would be not fresh fruit and vegetables, fresh fruit and vegetables. So yeah, so we have all loyalty card programs here. Some of the other grocery stores may do a coupon, or if it's a particularly small market, they do a 50% discount model. So crucial elements for success. We've learned over time that, you know, also in addition to trying to target places with high need, we also want the places to be successful. And so we look for, obviously, they have to be able to take SNAP. And if a farmer's market doesn't do that, that's where our partners from K-State Extension, MU Extension, Cultivate KC, and West Central really help a lot in terms of capacity building. that probably cannot even be measured, like how much capacity building is being done with farmers and farmers markets out there to try to even get them to this point. You know, just getting them to that is a huge step. So they have to be able to do that and be able to track their sales and report all that. Obviously, we want our markets to have a variety of fresh fruits and vegetables. SNAP customers are no different than the rest of us. They want to go and shop and see all those great, unique and different types of foods they want, just like we do. So we really try to encourage that. We also want their staff to be trained not only on how to, take the tokens and put that down, but also training on how to be welcoming and inviting to their market, just making people feel comfortable. For a lot of SNAP shoppers, this might not be something they do a lot. They might not go to farmers markets particularly. They probably go to the grocery stores, but depending on the community, but be welcoming, be a place where people want to shop. Yeah, and then also just kind of being where SNAP customers are is another point of success. So how have we been impactful? From 2016 to 2021, we distributed $5.3 million of Double Up food bucks, and about 3.86 million of that was redeemed, which is about 72% redemption. And then last year we distributed $2.45 million in Double Up food bucks, and about 1.75 million of that was redeemed. So it looks like we're, over time we are doing more and more every year. So that's a good thing, I guess. I just threw this in just as a reminder, like what we really do try to make this, even though we have so many different partners involved, we try to bring all these partners together, but from a customer point of view, as much as we possibly can, we try to make this look seamless. So, a customer in Kansas doesn't know that, K-State Research and Extension is kind of there behind theirs versus MU Extension on the Missouri side. We want this to look pretty seamless as much as we possibly can. So we have a wide variety of things developed to try to get the word out in a very as simple as an easy way as we possibly can. I mentioned our core partners, but honestly, in addition to our core partners, all of you are as equally or even more important than the core partners, because like I mentioned, you have those trusted relationships with whether it's clients, patients, customers, whoever you're interacting with every day. So we really do rely heavily. It's very difficult to get this word out to SNAP recipients. They're very busy people, just like we are. And I think right today we have so much information coming at us from so many different places that most of it honestly probably just goes away, right? We don't even acknowledge it because it's just so much. Our program has that same challenge too. So whenever we get a chance, we're trying to get the word out through people who can really say, hey, I think this program could really benefit you. You might want to give it a try. So to that effect, I have brought a bunch of brochures. I have brought both English and Spanish, and there's also a piece of paper that if those go away quickly and you want some, please feel free. We just got our 2023 brochures in, brand new. They're really nice, very colorful. So please feel free to take some. And like I said, if we need more, we'd be happy to mail them to you and get them in your places. And so hopefully into the hands of the SNAP recipients that you serve. And that's it. Okay, so I will mention really quickly our new program. So our new program is called KC Fresh RX. And it is a produce prescription program also funded by the USDA Gus Schumacher Nutrition Incentive Program. And ironically, the grants for those types of programs are significantly less than the nutrition incentive programs. The max is 500,000. But if you ask probably any produce prescription program grantee, if you know whether that even touches it, it's like it's very involved to do produce prescriptions. So we're learning a lot. Right now, we're working with 3 clinics. Sam Rogers, KU General and Geriatric Medicine, and also Advent Health Shawnee Mission. Those are the ones that are currently on the program. We're just fresh into it. And the idea is that they refer patients to us that are Medicaid patients that are also and that have also reported food insecurity during the last year and are pre-diabetic or pre-hypertensive. And then once we get those referrals, we reach out to them, kind of get them signed up into a 6-month program, which provides them a monthly food incentive on a gift card that's for fresh fruits and vegetables, and also once a month nutrition education classes. So hopefully next year I'll be able to tell you how that's going. So we're in our 2nd month of classes right now. So it's really been fun. Thank you. Any questions? You want to do those questions now?
No, great. I think let's give people a chance to ask you some questions. So
Sure.
that's really exciting. And how many people do you have registered so far in the KC Fresh?
So far, I believe we're at 23. We wanted 60, but like, you know, we're building the kind of the plane while we're flying it. So it's almost a little bit of a blessing that we don't have the full 60 this year, because we're just working through a lot of the kinks and all that. So so we'll make up those, hopefully we'll make up those numbers in the next couple of years. And we might even have the opportunity to bring on another clinic or 2. So.
And who's providing your nutrition education classes?
Right now, it's sort of driven by a nutrition education subcommittee. We've gotten input from both SNAP Ed programs on each side of the state, and a dietitian from KU Med Center is actually doing the classes and doing some videos.
Great. Dr. Kramer.
Thanks for your presentation. Question about the Fresh RX program. Did I hear you say that this is for pre-diabetic individuals and pre-hypertensive?
Yeah, what we wanted to do was to show a difference. So we get their numbers before, and then we'll take their their A1C and blood pressure and all that afterwards. And we wanted to do that with folks that maybe not already were on medication. So although I'm realizing now with that that's not as easy as we had thought a year or more ago when we were putting the proposal together, because now there's all the medications for weight loss and things like that are all, it's as everything, it's complicated, but there's a little fudging in there.
So if somebody has been diagnosed with hypertension or diabetes, they would not qualify.
Probably not, yeah. But we also know that there's probably people who haven't necessarily been diagnosed as an actual diabetic or having hypertension who may be already on medication too.
Right.
So.
I had a couple of questions. This is back to the Double Up Food Bucks program. And so you mentioned fresh fruits and vegetables. Even in the grocery store, is it just fresh? There's no frozen or any other?
It's just fresh. And the reasoning behind that is mostly because the bucket in particularly on the grocery store side, the bucket of items that they would have to monitor, it would just be, it would be so administratively intense to add for even frozen anymore, with all the frozen options that have sauces, or basically with the USDA grants, nothing that has an added sugar, salt, or oil can be used when they redeem their dollar. So that's
pretty
why.
complicated.
Yeah, yeah, I know some programs have tried it, but it's very administratively intense to kind of have to monitor all those labels all the time.
And is there any talk of expanding from SNAP to WIC?
I have not heard that, but I wouldn't be completely surprised if that happens.
I just see a lot of alignment from that.
Absolutely. I think they should. It may be more a matter of, you know, bureaucratic, like who manages which program, but I don't know.
Dr. Kramer.
You mentioned the dollar stores, Dollar General, et cetera. We've all been hearing a lot about their expansion, their being ubiquitous in small towns, et cetera. Is in this case, is the threat to health because they're putting smaller grocery stores out of business that might have carried produce? Is that it?
I mean, that's where I see the real. I actually had an opportunity to go to a couple different very small towns in Kansas. One in particular is Peabody, Kansas. They have a grocery store that was taken over by a woman who used to be, work in banking, but she just really wanted to make sure that her community had a grocery store. And so she and her husband bought this grocery store and learned it and all that. And then Family Dollar, when they come, they're not only coming in just one. When they come in only 2 or 3. And then they basically, they replicate pretty much everything you're selling. And so you are not able to, and then they cut the prices dramatically. So she lost immediately 25% in sales when the first one came in, and then the second one came in and it was just that much more. And the worst part of it is that she may still be able to sell produce, but produce is probably the most, it has the thinnest margin because you're losing a lot, right? You lose anything that spoils, you lose. So that's not making her money, and she was always prized that, she could have a fresh meat. So she had a butcher and she had very fresh and good locally sourced meat. Well, because her profits were then cut, she then had to lay her butcher off. So now she can't do that part of it anymore. And then the really ironic thing about it is that now the only way she can support the grocery store is by opening up a liquor store right next door, which I wanted to just lay on the ground and cry because, then it's like the healthy things that she wants to offer the community now can't make her money enough to support the store. So she has to go towards something that none of us think is, a good option for a healthy community. So, the liquor and the cigarettes and those things now are the money makers. And it's just, it's a little bit, it's a lot, when you hear that story being put out there. And that's only one example of many I've heard in the last couple of years in small towns.
I kind of wish I hadn't asked that question.
I know, I'm sorry. I'm sorry. Yeah. I mean, but that's where we are, and I think, living in Kansas City, I wasn't as aware of it as, I knew that there were certainly neighborhoods in our area where we have, a lot of that influence, but when there's nothing else available within like 60 miles, that's really hard.
And Janet, I think, did you have a question as well?
So not a question, just a comment. Just wanted to say that I refer a lot of families in for this particular service and support it wholeheartedly because not only are you helping the families and individuals, you're helping the farmers, so I go down to the city market every Saturday. And it's just really great to see that these families are able to come and double up.
Mm-hmm.
And then they can go to the farmers and they can spend that money. So I think it's just a dual service and it's really great.
Thank you. Thank you for helping with that.
For sure.
It's so important. I can't underline that enough.
Thanks for that comment, Janet, and
Yeah.
thanks for bringing your additional brochures. So
Yep,
don't forget to
got
put
it.
those
So
up before you
please,
go.
I don't want to take any back with me, so please grab them and let me know if you need more. Thank you.
Again. Yes, thank you. Okay, and so now I'd like to bring Jamie up and share a little bit about what Canby's Market is doing to increase access to healthy food. Thanks, Jamie.
Hello, everyone. As Shelley said, my name is Jamie. I'm here on behalf of the Canby's Markets team. I see a lot of familiar faces online and in person. So just going to give try to give everyone a brief understanding of what we do. There's often a lot of confusion with the name. Are you guys like harvesters? Are you guys a food bank? Are you a farmer's market? I hope I can kind of squash all of those. So without further ado, I don't think I have to spend too much time on the next slide, but just normally when I start presentations, just start with some definitions. As an organization, we're trying to get away from food desert language. Just from community feedback, a lot of negative connotations surrounding those words, really trying to get to the terms food apartheid, more so addressing, systematic issues, racial issues. So that's what our bread and butter is, addressing food apartheid in the Kansas City area, and getting healthy food into as many places as we possibly can, through many different systems. So food apartheid and food justice are our bread and butter. Our mission, we are trying to create more fresh and affordable access as one solution in the Kansas City area, right? We're all working towards creating greater access. This is just our approach. And I'll dive deeper into our flagship program, which is our Healthy Corner Store program, as we go through. And I'm going to skip this next slide because you guys all are familiar with these numbers. But since our launch in 2008, our CEO, Max Kaniger, started this pilot with 2 stores. He got 2 store owners to work with him and say, hey, we just talked about liquor and cigarettes. A lot of these stores that we work with do offer those things, but getting these store owners to work with us to provide access is a win in itself. And he was able to do it with 2 stores, found out, hey, people in our communities do want to eat good food. So since 2018 through 2020, we got up to 12 stores. Through COVID, we expanded, and now we're up to about 43 locations around the Kansas City area. So this is what one of our coolers looks like if you guys have never seen them. If you can imagine, a lot of the stores we work with, square footage is a premium, right? We can't put big, bulky coolers in there, so we had to go for a slicker, tighter model. So that's what our current cooler model looks like. We're also starting to implement some closed door models just with some of the stores we work with. AC is an issue. Not having too much turnover of food is an issue, especially in the summer months with how hot it gets. But if you walk into a gas station, a liquor store, a convenience store, and you see that, that's us. Okay. But just to kind of dive deeper, we have 3 delivery drivers that go out 5 days a week, Tuesday through Saturday. We just can't capacity wise do 7 days a week currently. But this cooler is at no cost to the store owner. Okay, so we own the cooler. It is on consignment basis. So 30% of the revenue that is generated from that cooler goes to the store owner. All they have to do is pay for the electricity, right? We restock it, we distribute it. All the shrink, as we call the expired produce, we pull out at no cost to them because we have to incentivize them, right? So this is just our current model. We're open to exploring other models as well. With the Fruit and Veggie Connect, alternative access points, we've really tried to talk to community centers, places of trust within communities, healthcare facilities to work with us. The point of sale system is always a challenge, but we're always willing to explore that option. So this is kind of a short map. That QR code will give you access to our website, which has all of our locations, but these are our current locations. We get a lot of questions, why aren't you in Wyandotte County? Why aren't you in Independence? We're a small team. We're a lot smaller team than people think. Everyone thinks Canby's is a lot bigger than it really is. We're a team of 12. including drivers. All right, so right now we're just trying to really focus on the urban core in Kansas City. If we can, prove the model that it works, we would love to continue to expand out into other food insecure areas as well. Another side of Canby is a lot of people know about the Healthy Corner Store program, but we redirect a lot of produce. So last year alone, we redirected almost 700,000 pounds of produce that would have ended up in a landfill otherwise. So we work with a lot of local distributors. We would love to work with more local farmers. We are exploring that option too, but again, capacity is a thing. Over 6,000 volunteer hours. We rely on volunteers to help us procure that produce. So we go around the city, say, hey, we'll take what you don't want, because it's amazing what distributors get rid of. We have volunteer teams that come in, help us, our procurement team, go through that produce. We get it in our cooler and we redistribute it back out into the community. So trying to address the food waste and environmental issues, as well as the access issues, is really, really important to us as an organization. Also, to get into the next slide. So these are our 4 paths of redirection within our redirection program. Obviously, the best stuff's going to go out to our Healthy Corner stores. But that next level, the community partnerships, is a huge part of our organization. We have over 30 orgs that pick up from us, from churches to other community-based organizations that don't necessarily deal with food, but they deal with social services, which this is a social service. But we provide a lot of produce. Maybe it's a little imperfect, or it's 1 or 2 days away from being expired. We want to get that out to people. So we schedule time with other nonprofits to come pick it up and take it to their organization. A lot of people don't know about animal feed partnerships. We work with Kansas City Zoo. We work with wildlife reserves. We get kind of that next phase of produce that's almost compost that animals can still eat. We provide that for them. And then we work with KC Can to compost all of the leftover produce. So we're a no waste organization. None of the produce you see goes to waste, even if it's pulled from our corner stores. And that's kind of the breakdown of how it evens out. We would like that HCS percentage to go up to lower food costs for the organization. But I mean, that donation percentage is really important as well. So, and then our next kind of phase is really ramping up our community engagement. We're actually looking to expand our community engagement team. Looking at voucher programs with healthcare partners, getting into schools. These are all really important things for us as an organization moving forward, because just a cooler itself isn't enough, right? We really have to get boots on the ground and take in that community feedback and understand community behavior and what people want in the coolers. So that's kind of our next phase in the organization. But that's all I got for a presentation standpoint. I'm open to any questions that anybody has for us. Yes, Don.
On your food redirection,
Mhm.
where are you collecting those from? Is it mainly retail, or is it like actual growers, or how does that work?
So predominantly right now we work with big distributors like CNC, Liberty, just because they're wasting the most.
Right.
And they will give, we can come in and get pallets and pallets and pallets from them. And so to kind of service our capacity needs. Again, we would like to work with more local entities if people are open to it.
I'm sorry, I have to leave due to an emergency, but I wanted to say real quick, hats off to Candace. I remember when we met with you guys and you were first starting out. I think you're doing just awesome things in the community. I love the redirection. I love what you're doing with the food. That's to prevent it from going to the landfill. So can't wait to meet with you guys more so we can collaborate and work together.
I want to take just a second and say thank you for those excellent comments, Janet. And I want to make sure everyone in the room knows Janet's role in access to healthy food. So she wasn't able to, she didn't get a chance to share. And now that you have to leave, you won't be able to. Her work with what used to be known as the Truman Healthy Harvest Mobile Market, now is it University Health Mobile Market, or just
Healthy Harvest Mobile Market.
Healthy Harvest Mobile Market. So she's been the program manager for that since its inception.
Not quite.
Okay, close enough.
Close enough.
So she has been doing great work in the community as well. And if you're not familiar with that, that was ATA bus that had been retrofitted for fresh fruits and vegetables. And they would go around to multiple stops in the Kansas City Metro on the Missouri side, trying to bring fresh fruits and vegetables to neighborhoods, senior living centers, et cetera. So she is an expert in the area of access to healthy food as well. And so thank you for coming in. We appreciate your comments, Gina.
Thank you.
Okay, Robin, yeah.
Great presentation. You guys are super efficient, it sounds like.
We could work on that.
Well, it seems impressive from the outside anyway. Maybe I missed this and you talked about it at the beginning when I was out of the room, but do you guys, is this self-sustaining? Do you operate on grants? Is this profitable?
Yeah, so currently we do operate on grants. The goal is to be more self-sustaining though. Because that if it's more self-sustaining, that means we're getting more produce out into the community, which is a good thing. A big part of what we do though is we want it to be affordable. We don't want to price. I forgot to mention that as part of our consignment process too with these store owners is, okay, if we're going to do all the work, we control the prices and we control the quality. So we don't want to price out community members, which is already a problem that we deal with. So that's the challenge of it, is how do we ramp up more redirection to get good food in so we can continue to lower and lower costs on that end. But right now we're not at a profitable state. We would like to get there. We could use a lot of other help from other organizations to help us increase capacity. But that's a great question. But yeah, we're not self-sustaining yet.
So food costs are probably the biggest barrier. That's right.
Absolutely, yeah. Our goal is to, right now, we're only redirecting about 15 to 20% on the high end for a week for the corner stores themselves. We would like that number, in the next year or two to get up to more 30, 40, 50%. But it's going to take a bigger team.
Yeah, those are great questions. And
Yeah.
so that kind of goes along with a couple of questions that I have in terms of where you all are going. So you mentioned schools, and I know we have a physical therapist here from Children's Mercy in the sports medicine department where they've been talking about options for athletes after school. And so what have you considered that as an option in terms of getting a cooler there? So at least there's fresh fruit that would be available for those that might not otherwise afford it. Of course, there's, I don't know how you pay for that, but that's a technicality.
Yeah, we've really looked at that. Obviously, point of sale is always the biggest hang up with that. So how do we develop a different model to work with community-based organizations that works for them? We're still exploring that, and we would love any pointers.
Or pilot projects.
Yes, pilot projects, like with you guys. Yeah, we would love to work with schools, cut down to any barriers we can for families, especially at a central location like that would be perfect.
And then do you also partner with organizations like After the Harvest?
Yes.
Who comes in and does their own gleaning and then, okay.
So they drop off once a week. We usually do a produce exchange with After the Harvest. Yeah, we have a great relationship with them. So if they, if they need certain items, we'll provide certain items for them. So, I mean, we're a nice umbrella resource too for other food organizations to get things that they need. They go out and glean things that we desperately need too. So we kind of do produce swaps to fill needs.
Excellent.
Yeah.
Do we have any other questions online? Or any other questions here in the room for Jamie? Okay, hearing none, I'm going to take just a second to role model physical activity here. So I'd like you all to join me in a standing ovation for all of our presenters this morning. Outstanding job. Great information. Really helpful. And I hope that that has sparked some ideas with many of you about how you can partner with other organizations. And I am going to pause for just a minute to give other organizations that are here at the meeting today to talk or share any information that they might be doing related to increasing access to healthy food. So we have Harvesters here. We have KC Healthy Kids who's participating virtually. I think there's somebody else that now I'm not thinking of, extension, or anyone else. So if you, while I bring the presentation up, if you all would like to share anything about what you're doing, you're welcome to come to the microphone so that everyone can hear you. Or Evelyn, you can unmute people online to share. Okay, that was short. Okay, well, that'll get us on to the rest of the meeting. So now we're just going to move on into updates. I think most of you are aware, and many people have mentioned who are attending today, we host sector meetings in conjunction with the work going on through the Kansas City Physical Activity Plan. So we're just going to give you a few updates on which each of those sectors are doing in their upcoming meetings. I'm just going to go through the slide, and then if we have the sector lead here, you're welcome to give some additional updates if you like to, but we'll start with the early childhood sector. That group meets on the 4th Thursday of the month from 9 to 10:30. Our next meeting is July 27th at 9 a.m. And there are two subgroups out of that sector that are working on the strategies of the physical activity plan. One is around resources for early care and education providers specific to physical activity. So doing an evaluation of what resources currently exist, are they utilized by providers, and how can we get them better access to those in a convenient way. And then Go Knapsack is a national resource available. They do assessments, environmental assessments of early care education providers, whether they're home-based or family-based, and then they provide resources in, I think is it 7 or 9 modules related to nutrition, physical activity. Let's see, there's farm to school, sleep, breastfeeding. Yeah. So we're taking a look at what that program exists in both Kansas and Missouri. And so they've shared a report with us from early care and education providers in both states to give us an idea of what gaps might exist and how we can help potentially fill those. Anything else you want to add to that, Rod? Okay, great. The healthcare sector, I see many people who attend our healthcare sector meetings here. I do want to recognize our new sector lead, and that's Jay Robertson. He is a sports medicine physician at Children's Mercy. He's been actively involved in the sector since its inception and is recently stepping into this lead role, as our previous lead is now moving on to different opportunities. That sector meets the second Tuesday every other month. So our next meeting is July 11th at noon. Typically for an hour. And there are two subgroups of that are actively working on projects. One is the Just Walk program. Have any of you heard of Walk with the Doc? Okay, so Just Walk is a program under Walk with the Doc that the format is a 5 to 10 minute conversation on a health related topic, followed by a walk for the remainder of an hour. Walk with the Doc, as you can imagine, is walking with a doc. Just Walk is walking with any healthcare professional. We like that broader approach because what we've heard and what you heard from Akira earlier is people want more information than just about their condition, mental health, nutrition, those sorts of things. So we take that model. We're currently doing a pilot series of walks at Harris Park. That is in Kansas City, Missouri, I believe in the Ivanhoe neighborhood. Our third walk was last night, and our fourth and final walk of this small series is going to be on July 12th. They're currently from 5:15 to 6:15. We might be pushing that back just slightly, but that QR code will get you a link to our information on the Just Walk website. This is a program we're hoping to expand to other locations. We're trying to partner with parks that already have an interest and ability to get the word out. We are changing locations in Kansas. We're going from Pearson Park to Antioch Park, probably starting sometime in the fall. So if anyone is interested in these or want to help us get the word out, they're free, open to the public. Just let us know. The other group under the healthcare sector is the curriculum group, where that group meets on the second Tuesday of the month from 11 to 12. We invite anyone to attend. We are bringing Dr. Jennifer Trilk to Kansas City, August 16th through the 18th. She'll present a grand rounds at Children's Mercy, and then we'll meet with local medical schools because we're working to embed lifestyle education into health professional training. We're starting with medical schools, but we also have interest for other nursing, other health sciences, PA, nutrition, PTOT, lots of different health professional schools to include this information. So very excited. If you're interested in joining us for those meetings, feel free. Other sectors are listed here. School sector meets the fourth Thursday of the month. Most groups, these groups here meet about monthly. So you can see the dates that are on here. If you, we do generally invite you to register for the meetings, not because there's a cost, but it gets you the access to the virtual link. All of that information can be found on our website, which is kcphysicalactivityplan.org. If you've signed up for our newsletters, this information will come to your inbox. If you haven't yet, you can always go to the website. If you lose the information, you can always go to the website. So this may seem like a lot of meetings. It is on our end because we're the ones who are helping to host those meetings. But it's really important as we're trying to connect our work across societal sectors, because without this amount of effort, it's going to be really difficult to make a change in terms of increasing rates of physical activity in Kansas City. There are 3 additional sectors that are not currently meeting on a regular basis. Business and industry, it's because we're about to start doing that. We have sector leads. Tanya Williams, who may still be on virtually, is one of the sector leads for the business and industry sector. The other one I didn't see on yet this morning. So we're actively working with a Greater Kansas City Chamber of Commerce to align with their workplace wellness committee to get this moving forward. The infrastructure group, there's a lot of great work going on in the Kansas City area related to infrastructure. We're working to align with those efforts versus replicating something. And then faith-based settings. So as you might imagine, faith-based settings have been working really hard to get people back into their churches and involved in those activities. And so we are waiting for them to invite us back into their settings to move this work forward. We've already heard mental health addressed quite a bit, a lot of issues there that they're trying to manage, but we're excited to bring opportunities to that sector as well. Any questions about those before I move on? Anything anyone else wants to say? Yeah, Robin.
I'll just want to add that we have funding to distribute to our partners to support implementation of the Kansas City Physical Activity Plan strategies and tactics. There is a minimum of $12,500 that will go out to the sectors. There probably will be more than that. So if you have a project or you're thinking about a project that you think might align with the strategies and tactics of the plan, it's always good to attend one of those sector meetings, talk to the sector leads, just say, hey, I'm thinking about this. The application is like 10 sentences. We made it very, very easy. We make it very clear on how the applications are reviewed, what gets you points and what will get you funded or not. So it's kind of easy money, if I can say so myself. So we want to distribute this money out to our partners. So if you're interested, if you're looking for funding, start attending those meetings, talk with the sector leads, okay? Or you can talk to one of us.
Absolutely. Any questions about any of that? Okay, I'm going to skip this right now because I didn't bring up the website. If you would like me to review where to find things on our physical activity plan website, I'm happy to do that, but I want to go ahead and pause for just a second and give any of you, whether you're in person or online, a chance to share any updates you have for your programs and organizations. Rhonda.
I guess I would just share. So I'm Rhonda from Harvesters, and in the last year, we have partnered with School Smart KC. And we have brought on 29 school pantries that are in the KCPS school district. So that's including charter and public schools. And they were able to raise dollars that they gave kind of like starting, I guess, seed money to the schools to set up $500 for any setup fees, maybe shelving or signage, refrigeration that they would need. And then also they committed to give them $2,000 each school site. And that would be for any fees for co-op food that's at Harvesters. So always making sure that they are looking for the items that are donated at Harvesters. So there's no fee to that, but also looking at other things to help advance their school pantry. And then this next school year, 2023-24, we are bringing on, I believe it's 16 more schools in that district area. And so we're appreciative of their partnership and the school's commitment to meet students and families where they are.
So that sounds like a huge expansion of food pantry programs within schools.
Yeah.
Wow. And you said the Missouri side or?
That's correct. Yep. KC.
Okay.
Yes.
And any opportunity or interest in expanding to KCK?
Well, all our 26 counties that Harvesters serves can apply for a school pantry program. They just have to, the school has to have a 501c3 sponsor, so either a nonprofit or a church that qualifies under the IRS regulations to receive donated foods. And so we have around 60 across our 26 county areas that participate in the school pantry program, so 60 schools. And yeah, if any partner is interested in doing the same model as School Smart KC, we welcome that.
Great information. If you have more information about that you'd like us to include in our monthly newsletter, we're happy to help you get the word out about that. Rhonda, thank you. Natalie, yeah.
I have a question. So like, what are examples of those partners for the schools that are those 501(c)(3)?
That can be churches, that can be other nonprofits, just anybody that has a 501(c)(3) IRS determination letter. Yep. So they have to, their sole purpose has to be to feed the ill and needy.
Dr. Kramer.
This is just kind of a general update on a community health improvement project with the Jackson County Health Department, which I think is now named Jackson County Public Health. I should know, but I think they just did a recent name change. And just getting started on this, but we have identified key priorities, and those two being mental and behavioral health and economic security / affordable housing / lots of other things that contribute to economic security and are affected by economic security or lack of for individuals and families. So if anyone is interested in participating in any of that, please let me know. I'll connect you.
And you said that's with the Jackson County Health Department and their community health needs assessment.
Exactly, and everybody probably knows the Jackson County Health Department. Technically, it does not include Kansas City, Missouri, which of course has their own health department. And it sort of doesn't include Independence, which now once again has their own health department, but we have representation from Independence. And I think we're going to be active in Independence. So
great.
It's Eastern Jackson County, you know, kind of the exception of Kansas City.
Okay. Thanks so much. Yeah.
In the chat, Bill Brandmeier said that he was willing to be a 501(c)(3) partner for one of those Harvesters programs for school pantries. if someone's interested in connecting with them.
Okay, so that's great. Thanks, Bill. We got that message. We'll connect you with Rhonda and see how you might be able to help her help harvesters expand their programming through schools. Yeah. Yeah, Alex.
Yeah, so I sit on the sidewalk prioritization committee for Kansas City, and we're approaching the final phase. So this is prioritization of rebuilding the sidewalks, not new sidewalks. So just keep that in mind. But it is soon there will be a public tool available so that you can actually see where the sidewalk repairs are planned, and they've been using the map that we generated that demonstrates rates of physical activity by census tract as part of that prioritization, as well as the life expectancy map that we generated. So just keep an eye out for that. It's, you know, it's tangentially related. You got to use the sidewalks to exercise sometimes and to get to places when you don't have transportation. So
Yeah.
I just wanted to mention that.
So physical activity and access to healthy food. Yeah, both. Thanks for sharing that, Alex. Anything else? And anything else online, Natalie, that you see? Okay. Well, with that, we're going to let you out a little bit early this morning, and we thank you so much for joining us here. Please don't forget to complete the evaluation. We're trying to make it really easy on you. Just scan that QR code. It'll take you to just a few short questions. We do look at your feedback, and we do make changes based on the feedback that you give us. So thank you so much again. Thank you to our outstanding speakers. I hope you've gotten some ideas about how you can partner with other organizations to do this work together, and get your walking in today. 5 miles sounds about right. Thank you.